Hey everyone, and welcome back to This Explainer. Today, we're diving into a dense, but honestly incredibly fascinating medical topic, the pathological origins of hepatic cirrhosis. We're going to explore exactly how this profound liver condition develops, and we'll take our time to clearly walk through the medical terminology and the underlying physiological mechanisms. So here is our game plan. We'll define hepatic cirrhosis, look at how it's classified, explore the etiology and pathogenesis specifically for alcoholic liver disease, and then finally walk step by step through the pathological stages. Let's get into it. Section 1, Defining Hepatic Cirrhosis. To really wrap our heads around this disease, we have to start with the precision of the medical definition. Hepatic cirrhosis isn't just some localized injury. It's a condition that involves the entire liver. What happens is that the normal lobular architecture, the natural structural layout of the liver's functional tissue or the hepatic parenchyma, becomes entirely disorganized. The absolute defining hallmark here is the formation of nodules that are separated by intervening bands of fibrosis, basically heavy scarring. This massive structural remodeling essentially follows the death of liver cells, which is known as hepatocellular necrosis. This widespread disorganization, that's the fundamental baseline of the whole disease. Now, a really important clinical caveat from our source material. While you'll often see areas of necrosis alongside regenerative nodules in a cirrhotic liver, regenerative nodules are actually not strictly essential for the diagnosis of cirrhosis. The main takeaway is the widespread disorganization and those intervening bands of scar tissue. Moving on to Section 2, Classifications of Cirrhosis. Medical professionals use two primary pathways to classify cirrhosis. On the structural side, we have morphologic classification. This looks strictly at the physical shape and size of the damage, breaking it down into micronodular cirrhosis, macronodular cirrhosis, and mixed cirrhosis. But conversely, we have etiologic classification. Rather than looking at the physical shape of the damage, this categorizes the disease based purely on its specific underlying root causes. Which brings us to Section 3, Alcoholic Liver Disease Etiology. So what actually causes this specific type of liver disease? Well, it's not just the presence of alcohol alone. It's really a combination of interconnected factors that set the stage for the liver's battle against ethanol. The etiology is rooted in an individual's specific drinking pattern, combined heavily with malnutrition, any concurrent infections, and even underlying genetic factors. All of these variables interact and compound to trigger the disease. Section 4, the pathogenesis of alcohol. Let's look at the physiological story. The mechanisms of hepatotoxicity map out this devastating, cascading chain reaction of metabolic stress. It begins right at the top, with direct toxicity by the ethanol itself and its breakdown metabolites. This triggers severe free radical damage and an increased redox ratio, which is essentially a massive chemical imbalance within the cells. Because of this intense cellular stress, we see the retention of liver cell water and proteins. That rapidly leads to hypoxia, cellular oxygen starvation, and significant liver fat accumulation. Finally, this deep cellular distress activates complex immunological mechanisms, culminating in fibrogenesis, which is the creation of scar tissue, and systemic inflammation. It is a relentless physiological progression. Section 5, Stages of Pathological Changes. The essential thing to understand here is that hepatic destruction doesn't just happen all at once overnight. There are three clear chronological steps in this pathological journey. First, we start with alcoholic steatosis, which is commonly referred to as fatty liver. Second is the critical intermediate stage, alcoholic hepatitis. And third is the final, most severe structural collapse, alcoholic cirrhosis. Let's look really closely at that first stage, alcoholic steatosis. There is a stark, fascinating contrast between the gross anatomical changes and what is secretly happening under the microscope. Grossly, to the naked eye, the liver becomes significantly enlarged. It turns a yellow color and feels greasy and smooth. But microscopically, we see exactly why. The hepatocytes are filling up with macrovesicular and microvesicular fat droplets, essentially these large and small pockets of fat. These fat droplets are literally displacing the nucleus of the liver cells, all while immune cells like lymphocytes and macrophages begin to infiltrate. It's a picture of a liver becoming utterly overwhelmed. Moving into the second stage, we hit alcoholic hepatitis. This is a highly dangerous intermediate stage that prominently affects zone 3 of the liver. Here, we first start to see actual hepatocellular necrosis. A major microscopic identifier you absolutely must remember here is the presence of Mallory bodies. These are clumps of damaged proteins, also referred to as alcoholic hyaline. Accompanying these Mallory bodies is an aggressive inflammatory response, and crucially, the active onset of fibrosis. The liver is now actively scarring. To give you a physical sense of this early progression, just think about this weight, above 2 kilograms. This highlights just how dramatically enlarged and swollen that tawny yellow liver initially becomes under the heavy, heavy burden of fat and inflammation. But contrast that massive initial enlargement with this figure, less than 1 kilogram. This represents the stark, frankly devastating weight reduction that occurs as the disease progresses into its final stage. The liver completely transforms from a massively swollen, fatty organ into something severely shrunken, hardened, and diminished. And that brings the physiological story to its grim conclusion with alcoholic cirrhosis. Grossly, we are looking at a drastically shrunken liver, though it maintains a tawny yellow appearance. Microscopically, the true destruction is undeniable. That once organized lobular architecture we defined at the very start, it's completely disrupted. Thick, fibrous septa, heavy bands of scar tissue, just carve right through the tissue, separating areas of necrotic hepatic parenchyma, all while chronic inflammation persists. The structural integrity has entirely collapsed. Which leaves us with a profound question to ponder today. As the liver shrinks to less than half its normal size, totally consumed by heavy scar tissue and necrosis, at what precise point does this disorganized lobular architecture truly become irreversible? It's a really striking reminder of the sheer fragility of our hepatic architecture. Thanks so much for joining me to explore this complex topic today, and I'll catch you in the next explainer.